Hello, and thank you all so much for joining us today. This is Schedule a Session with Easter Seals Bay Area. Today we're going to be talking about unblocking growth and retaining talent in home and coordinated healthcare. My name is Marie Francis, and I'm the Senior Director of Product Marketing here at Schedulo, and we're very grateful to our customer, Jeff Hallett, who's Vice President of Product Management at Easter Seals Bay Area, for joining us today to share his story about how they are managing their extensive mobile workforce to better support their clients throughout the Bay Area and Hawaii using Salesforce and Schedulo. Thanks so much for joining us, Jeff.
My pleasure, Marie.
So first off, I'd like to just offer Schedulo's point of view on the talent squeeze in healthcare. It's really a story of supply and demand and how demand for healthcare is vastly exceeding current supply of talent in the marketplace and what that's going to mean for businesses in home and coordinated care. And then I'll turn it over to Jeff, who will share all about Easter Seals, their process and operations, both around managing their practitioners as well as their client care process, using both Salesforce and Schedulo. And then Jeff will wrap it up with tips and tricks from one of the best in the business. So let's get started. So first, let's talk a little bit about the demand for home healthcare and how that is on the rise in the US. So there's a few key figures to help put some context around the demographic story here. So there are roughly 55 million Americans that are going to be age 65 and older by 2020. And it's Americans age 65 and older who actually consume the greatest amount of healthcare services in the country. And in particular, the greatest amount of home care services are directed towards the elderly who are primarily on Medicare. And because of that growth, you can see a really amazing, nearly 10% annual growth rate in the in-home healthcare market. So we're already seeing demand rise at a very steady clip, and that's really manifested in the 1.2 million new jobs that are going to be estimated to be needed for home healthcare aides by 2026, which is a really enormous segment of the marketplace. I mean, 1.2 million is the size of a large metropolitan area, just to really put some context around what that number means in real terms of people. And so as we see this aging population and this increased needs for home healthcare aides, we also see a really increased emphasis among patients in that doctor-patient relationship. They don't just want to get, medical services are not blind. They're not whomever is available that day. People want to know that they're seeing someone who knows them. And the way that Americans in particular judge quality of care is really in that doctor-patient relationship. So those are some of the changes that we're seeing kind of on the demand side of this marketplace. And as that is happening, and we're seeing this really, seeing this increase in demand that's just going to get higher and higher, we know that we are going to have a shortage of healthcare workers in this country. This is not a secret, and we even have some really strong data around this problem. And so in particular, we're going to need 2.3 million new healthcare workers across categories in the US by 2025. And as you can see, the overwhelming majority of that gap is going to be in home healthcare aides. So we know that there's going to be 1.2 million new jobs in home healthcare aides, or that's the estimate, by 2026, but we're going to have a gap of nearly 500,000. And that should be a very scary number, frankly, to anyone in the home healthcare industry who is trying to staff practitioners and staff talent. So we know this problem is coming. And so what does that actually mean for businesses in this industry? It means that things are going to get more complicated because, as we mentioned already, not only are expectations changing among patients, but caregivers are as well. Caregivers are very aware of how in demand their talents are, how in demand certified healthcare providers are, and they expect to be able to do their jobs with the same level of efficiency as their friends working in other industries. Once everyone's had, the Amazon or the Netflix experience as a consumer and knows that level, that smoothness of experience is available, they want it. And that's a very reasonable thing to want. Once you know things can be that good, why shouldn't I have that as well? So expectations have gone up really significantly on the caregiver side of the equation as well. So altogether, this is going to create some challenges for home healthcare providers. And alarmingly, healthcare IT systems up to this point really haven't been designed to deal with these challenges. In the beginning, they were really just kind of replicating some paper-based systems. And then they kind of became, digital record keeping, but essentially just mimicking whatever paper processes were. And then as healthcare IT was developing, compliance, and around the time that HIPAA came into practice in the 90s, really started driving design throughout any healthcare IT system. And so that was kind of directing the way healthcare IT was developed until cloud computing came about in the 2000s and mobile devices. But the healthcare industry has generally been a late adopter of these technologies. And so what we see a lot in the marketplace these days are that different businesses, even ones that are much further along in their technological maturity, still have the challenge of disconnected systems. So these things are creating redundancies as opposed to efficiencies. So that's why we're really excited to have someone with us today who's actually figured out this problem for their business and can offer others in the home and coordinated care space a solution and a point of view about how to rectify these challenges. Yeah. Jeff, I'll turn it over to you.
So
Thank you.
Marie. Thanks for setting that stage fantastically. So as we go into this, we'll talk a little bit about Easter Seals. Easter Seals is a national network, a national group of affiliates, about 73 affiliates, nationwide, serving about 1.5 million, families and children. Typically, Easter Seals focuses on, disabilities and special needs, helping them basically to just live, learn, work, and play like anybody else, basically trying to boost their quality of life. And they have a variety of services that they provide. Here in the Bay Area, we focus predominantly on behavioral health services. So things like families with autism, a variety of locations on the spectrum, behavioral health, occupational health, speech therapy, early intervention, occupational support, things like that, what we kind of focus on here. So really the Easter Seals, kind of journey for Bay Area, I mean, we've been around for about 90 years, but really took a dramatic turn in 2012. And as in a lot of cases, a lot of industries, a big part of that was legislation. For the first time, legislation came into effect that recognized, autism and behavioral health as a service that would be governed by insurance. So insurance providers and funders were under immediate obligation to start treating behavioral health services in the same way they treated other types of health services. We kind of responded immediately by developing the BHPN, the Behavioral Health Provider Network, and then kind of got on our fast technology track between then and today. And in 2017, we actually crossed the 1 million treatment hours per year that we manage. And just earlier this year, we absorbed an affiliation with our Hawaii affiliate. So now Easter Seals Bay Area and Easter Seals Hawaii are directly, unified in terms of providing West Coast and South Seas services for behavioral health.
Aloha.
Yeah. Mahalo.
Oh, yes.
So to kind of translate that, into some other terms, you think about where we were in 2012 versus where we are in 2018, we've essentially seen a growth of over 340% in terms of client volume. And obviously the first bolus of that was in the first few years, as soon as it was able to be reimbursed, able to be funded by insurers, suddenly there were avenues for people to get help that they never had before. And so they really reached out, and grasped for it. There was about a 600% increase actually in the first few years.
Wow.
And now that's leveled off just a little bit, partially because a lot of the upstream referral systems that feed us have started to become capacity, constrained. In California, we have to actually be referred. We have to have clients referred to us, by a diagnosing, physician. In some other regions and other states, that's not necessarily the case. For example, Hawaii, the vast majority of their cases are walk-in as opposed to direct referral. But either way, we've seen a tremendous growth, in the number of clients. And that obviously creates a tremendous strain, on an organization and on an infrastructure that was not geared or designed for that. So we knew we had to do something very different. To help support that growth, our workforce is actually predominantly mobile. If you look at the chart here, our direct clinical people, our behavior interventionists, our practitioners, about 70% of our clinical workforce are entirely mobile. They are going out into homes, into community centers, and so on, meeting the clients where they are. About 20% of our clinical staff are supervisory staff. They are partially mobile in the sense that they will sometimes go out on appointments to provide supervisorship. They'll be doing assessments and that type of thing. They'll be doing oversight, on the interventionists. So they split their time between office work and field work. And then there's administrative staff that kind of supports the whole engine behind the scenes, about another 10%. So if you look at this, we suddenly have a clinical staff that is 90% roughly mobile in some capacity or another, creating a tremendous challenge.
Yes.
Our stakeholders, really break down into the three cases, and they all have very different needs. If we look at the client, client families, these are families typically under stress. They need a lot of flexibility in how they schedule their time. They have a lot going on. Mom's working, dad's working, kids trying to do school, other programs going on, a lot of demands on their time. They need to make sure they're getting the right type and level of service, the number of hours that they need, the right number of hours, the right program, the right therapies, and so on. And quite often these families need support too. It's not just the client that's directly receiving therapy. Sister, mom, grandma, brothers all sometimes need coaching and support as well, dealing with these situations. On the other end, you got the business itself, in a healthcare industry that's becoming increasingly cost conscious, increasingly driven to provide better results for less money. And obviously, the business is very keen on making sure we have very clear standards of care, that clients are seen in a very timely manner, that they're moved through the system, effectively, they don't get lost in process. Yeah. In behavioral health, it's very easy for a client to be in therapy and remain in therapy for years. Mm. You just got to be careful to be on track of when they really don't need care anymore. Can they be moved on to something else more effective for where they are? And then lastly, efficiency and outcomes, just making sure that we are really seeing the positive results in quality of life for these people for the therapist hours that we're putting into it. Yeah. And if we start to notice that they're not responding the way they should, making sure we circle back very quickly, reassess what we're doing, try something different, get them on a pathway where they'll get more benefit out of it. And quite often, a lot of the clients will see several lines of service throughout their time with us. As they progress in one area, they may then need therapy in another area to supplement. So very challenging, very dynamic, care cycle. We knew that in order to keep up with that rapid growth, to keep up with the very dynamic nature of, this healthcare sector, we were going to have to rely on technology. We're going to have to rely on really great partners in the technology space to get the types of agility, that we needed in our technology solutions. We clearly have to respect the regulations around things like privacy and security, but we then also needed partners on top of that where we could very quickly get solutions to market, pivot when we need to, and integrate with best-in-class solutions whenever we could. So here's kind of a picture of our client care cycle at a high level. We knew that if we were going to have the impact on the practitioner's quality of life, the practitioner's engagement, as well as the client, we were going to have to design our applications around the care cycle itself. A lot of EMR systems are very focused on the logistics of basically, turning billing codes into cash. That's where they're kind of designed. We knew that we had to take a very care-oriented approach so that, we can create that positive impact, on the clients and also on the caregivers themselves, the practitioners themselves. So we built it all around here. You can see a lot of the front end of this cycle is very linear. It's basically very logistical and administrative. The whole process of taking someone in, getting them registered, getting them assessed. But once the actual treatment and therapy starts, it becomes highly dynamic. Going through placement and treatment and then re-review and then potentially reassessment and, potentially, redesigning their treatment plans, on a very regular basis. So we knew in particular when we looked at, partners like Schedulo, for example, that, they had some very special qualities and capabilities that would directly benefit certain parts of this care cycle, particularly when it came to matching clients, with the right practitioner, with the right provider, managing the overall caseload for this highly dynamic and mobile workforce, and then scheduling, that workforce, with the volumes that we were doing. We knew that we needed an expert, to partner with, and a technology, to help us do that in these applications. So basically, we built an application suite, and this is a sample of our application suite. You can see we've tried to put in some kind of technology solution at almost every major part of the care cycle. In particular, the things we'll talk about today again are related to what we call Sparkle Time, which is our matching and scheduling application. Schedule has been a fantastic partner working with us in that area, and we know that we'll be able to only continue and grow the capabilities in this area over time, thanks to our partnership with them.
So, if I could ask a question, how did the name Sparkle Time and what the nomenclature here? Why are we sparkling?
So Sparkle actually is a legacy term. It actually is an acronym. I will confess that I don't have all of the pieces memorized, but it is an acronym that tries to emphasize, the key values that we try to go into the application suite with in terms of accessibility and, meeting regulatory compliance and knowledge management and all of those types of things. And we try to build into it. And then, of course, the second letter just kind of helps identify what part of the care cycle given application would go to. So Sparkle Clinicals relates to how we do treatment planning and clinical data collection. Sparkle Charge, Sparkle Connect, how we do revenue cycle management. And then Sparkle Care is basically our kind of logistical case management, referrals management, practitioner management, side of it. So,
got it. I like that. I had no idea.
Yeah, so that's it. Yeah. So thinking about, kind of some of the functionality that is in there, client placement obviously is one of the first things we have to do when we have a new client. We got to find out who the best practitioners, who the best providers are for that client, given a wide variety of demographics and discriminators. So thinking about their location, how far away they are from, source of therapy, their language, what types of behaviors are they exhibiting. All of these types of things are all factors into how we have to go out there and figure out just who are the best ones to work with. And given that we get roughly, 300 to 400 new referrals a month, this team is extremely busy, taking the assessments that are done by the clinical managers and saying, who are the right people to work with this client, going forward. So, we have, very dedicated parts of our application to make that happen more easily.
It's a lot of new clients coming in.
It is. Scheduling and capacity management. Once we kind of have them placed, the scheduling process starts. And, that's a challenge. And you'll see on a later slide, we deal with roughly 25,000 appointments a month for these people, across these hundreds of, practitioners, out there, driving around, moving around, extremely dynamic, where we have to fit the practitioner availability with very limited family availability within specific regions, of the different offices. It's definitely keeps our scheduling team very, very, hardworking.
Yes.
To say the least.
Yeah.
And, using tools like Schedulo is provided definitely makes it possible for them to do this. They used to use spreadsheets. They used to use paper stuck to the wall, flip charts on the wall, you name it. They did everything they could. And without electronic tools to help them kind of optimize these schedules on a daily, in some cases hourly basis, it would have been impossible, for them to do. And then again, like we say, in order to do this effectively, you got to be able to visualize these calendars all the time, see the availability, someone cancels, can we quickly get someone in place? How do we minimize, gaps in care? How do we, just make sure that, clients are always receiving the best care that they possibly can, and the practitioners are, being worked at a sensible level. I mean, because a big part of their lives is they have quality of life as well, making sure that their driving time and the amount of work that they have to spend dealing with logistical things is minimized in favor of doing what they love to do most, which is actually deliver care to people and build that relationship with the client. And as long as they're feeling energized in that way, we know that they'll keep doing the best job for us and the clients that they possibly can. So we kind of tried to design all of our applications and so on around that notion of just letting caregivers and practitioners focus on giving care and let the software take care of the mechanics and logistics as much as possible. Yeah, so kind of just looking at some of the results that we've achieved through our partnerships with people like Schedulo. Like we said before, 25,000 plus appointments managed a month. That can't be done by hand. That requires top-notch partners and technology to make that happen. Currently, our network is over 90 provider companies that basically allow us to handle over 10,000 healthcare practitioners at a time. We're dealing with a little over 6,000 clients a month, in our active census. That brings us about $250 million of revenue, and our partnerships have basically allowed us to bring new applications and new capabilities, to our clinical force, in under 6 months of cycle time. I mean, right now we're delivering new releases every 6 weeks, to our partners, and because of the partnerships that we've made and the very smart technologies we've chosen, we can just continue to build on that trend.
That's a really aggressive development schedule.
Yeah.
That's impressive.
So kind of just to recap a little bit, when we think about, unlocking growth and driving retention, in our clinical workforce, I think one of the things we found right off the bat is that if you really want to engage and delight clinical people, you have to bring them solutions that allow them to focus on clinical care. The less they have to worry about filling out forms, doing a lot of artificial, techie, ITE stuff, the happier that they're going to be, because they got into the business to take care of kids that need their help to have high quality lives, and we want to give them solutions and let them do that. If we're going to grow clinical impact, especially at the level that we're doing and at the numbers that you talked about in the introduction, you have to have platforms and partners that can scale. A lot of technology, as you mentioned before, Marie, in this industry is built on very legacy, very old technology that frankly is just not scalable at the numbers and the volumes that we're seeing coming through the healthcare system today. So we have to start getting on technologies that can scale, with our industry and with the types of clients and customers we're going to be seeing. And it's also not just about technology. I mean, people have to be willing to break their frames to enable growth. If you're just trying to replicate old processes and old techniques that were built around old ways of doing things, you're just going to get the same old numbers. Mm-hmm. If you're really going to make a quantum leap in terms of your impact, you have to rethink the way you approach, the way you work, as well as the tools that you use. So people can't be afraid to reinvent themselves and really think about optimizing the way they work on an almost daily basis. And lastly, to do all this, you got to surround yourself with great partners. Nobody today can be an expert, a best in class in every single thing. A lot of technology providers claim that they are best in class solutions in a very broad breadth. Our experience is that that's not true. Every technology vendor has its strengths. Every technology vendor has its weakness. And you've got to go out there and find partners that bring capabilities you don't have. Mm-hmm. And capabilities that augment the weaknesses and build on the strengths of the other partners you already have in your stable. Yeah. So you just got to go out there. Don't believe you can do it yourself. Go out there, find smart people and great people to work with, like you guys, that can just help you get on the path to your success.
Thank you. We are so excited to have Easter Seals as a customer and a partner, and not just because you guys do what you do so exceptionally well, but it actually really does mean a lot to us, like who you're serving. And, for us as a technology company to be able to, as you say, it's all about helping the clinicians and the practitioners in the field do the job that they came to do, which, you talk about, when I hear you talking about helping kids and families have a higher quality of life, it really, honestly, it makes me very happy to know that there is a small piece of that we can help you guys do. And having you guys as a partner has just been a wonderful experience. And so thank you so much for your time today.
My pleasure. Yep. It's exactly that keeps us coming to work every day too. And, jazzes us to work with guys like you. So awesome. Thanks a lot.
Thank you so much, Jeff. And thank you everyone so much for joining us today. And I hope you will, if you're interested, please sign up for a demo. We'd love to show you more of Schedulo and the product. You can go to schedulo.com/demo and we will be back with you right away. Thanks for your time today. And thank you again, Jeff.
Yay.